see you all. We're going to talk about stigma. 10 years ago, my friend started this conference. He had a girlfriend with bipolar disorder. His very next girlfriend had a psychotic break, schizophrenia, and he realized he knew very little to anything about mental health and mental illness. So he's a marketer who looks at things from a marketing lens and started this conversation in a little classroom at Lipscomb University in Nashville. And here we are 9 years later at this iteration. And stigma and awareness is at the heart of what we do. We were cited in a lawsuit that kind of led to the Legit Scripts movement, which I think is net positive, whatever your interaction is with that service or not. I think it's great. And so fast forward to 10 years, Melissa is one of those gets, another one of those gets that's been on my list for a long time. Like, oh man, ideally, how could we make this happen? And here she is today for the first time at MHM. Thank you so much. Thanks for coming and sharing your expertise. I'll hand it over to you and just appreciate you so much.
Yeah, I'm so happy to be here. I met Steve a few years ago, and I was so excited that he wanted to talk about stigma, because this is not the sexiest part of mental health marketing. So I appreciate all of you coming to this session. You've got other options. And I always feel that talking about stigma, we all have to look a little bit at ourselves too, not just at us as marketers or communicators or practitioners. We need to look at ourselves and our own judgment too. So appreciate all of you being here, and very excited to make this my first mental health marketing conference. I know I'll be back. It's really good energy, and we don't often get just the people focusing on mental health. I do a lot of events that are straight healthcare, and this one's really special. This is very different. So I can tell you a little bit about myself. So I'm a long-time healthcare and growth marketing leader. I've been corporate at places, payers like Optum and Stigma. I did PBMs like Express Scripts. But then I spent 10 years at Hazel and Betty Ford, which is the nation's largest nonprofit substance use disorder and mental health organization. And that's really where I got my passion for breaking down stigma around mental health and substance use disorder. Because as I should in marketing, I should look at the competition. And what I discovered was our number one competitor was families that did nothing. And so it wasn't another treatment center, it wasn't another provider, it was families that were just stuck and couldn't move forward. And so often, the reason they didn't move forward was, what would the neighbors think? What would the people at work think? I can't go to a month of inpatient care because everyone's gonna find out. And that's a really sad situation. So that's when I got so passionate about stigma. So let's talk about this session, some of the objectives, really focusing on what is stigma, understanding the impact. Then we'll do some examples, sort of the good, the bad, the ugly, of language and imagery. And finally, let's talk about some solutions that we can implement to break down stigma. And I think, for whatever reason, mental health and substance use disorder tend to be some of the most stigmatized conditions. But there's other stigmatized conditions out there. And one example I'll use is obesity. And these days, we're having more of a conversation around obesity, but I still think there's a lot of people out there that don't see obesity as a chronic healthcare condition. We're having more of a conversation now that we have all these GLP-1s available, and people are starting to see, oh, there's medication for obesity, maybe this is a healthcare condition. We need to make progress in the same manner with mental health and substance use disorder. And I've got some research in the presentation, and you'll see we're making progress on mental health, but substance use disorder still has a long way to go. So first, let's define stigma. And I've got a couple of what I think are really great examples, and then one that I use a lot. So this one is a quote that I stumbled across, that stigma is the process by which the reaction of others spoils your normal identity. So it's all about the reaction of others. And when I think about working in substance use disorder, it was the reaction. Those families worried about the reactions of their neighbors, their friends, their coworkers. Here's another really good one from Brené Brown, who's become a real thought leader in the behavioral health space. She says, sometimes the simple act of humanizing problems sheds an important light on them, a light that often goes out the minute a stigmatizing label is applied. So she's talking about that stigmatizing label, and again, it's others labeling us or labeling our patients. Here's an example that I use in healthcare, kind of a definition. So what do we mean by stigma in healthcare? Stigma is when negative labels or judgments cause people to feel ashamed or isolated, often stopping them from getting the help that they need. So it's the negative labels, it's the judgments, causing people to feel ashamed or isolated, and they're not getting care. And that's one of the saddest things for me about all of this societal stigma, is that we've got care available. You're all here as marketers or practitioners in this space, advocates in this space. We know there's care available, but people aren't willing to reach out their hand for help. And we see that, like I said, with obesity. It's kind of the game has started to change with obesity, but we still see that with other conditions, that people are afraid to reach out their hand for help. So can I just see you raise your hands? Who's here a practitioner? A couple. So everyone else, are you marketers, communicators? Okay, and I know we have some advocates too. So thank you. That helps a lot, because I think all of this stigma conversation is anybody, not just who works around the behavioral health field, but it's like any person out there. We all need to think about what we can do to help break down these stigmas. So let's see. This got a little video about stigma. Stigma, but I think it's such a good example because, oh, he's lazy. He's not even bleeding, so I can't see anything wrong with him. He's probably faking. All these things are things we hear about, said to people who have mental health or even substance use challenges. So let's dig into the research. There's a lot of research out there on stigma, and so some of it's good, some of it's bad, but all of it's pretty fresh and new. This one's really positive. I think almost all Americans surveyed said they see mental health conditions as legitimate medical illnesses. That's positive. They're starting to see that yes, this is legitimate, positive thing. Most people say there we go. Okay, and here they say they're also they're managed like chronic physical conditions. Great. We know, the people in this room know, that mental health is a chronic healthcare condition. It's much like diabetes or hypertension. Nobody ever squawks about someone with high blood pressure taking high blood pressure medicine every day for the rest of their life. Why do they say, well, you can only take your mental health medications for a short period of time? So it's good. So we're seeing that most people that were surveyed see it as a chronic physical disorder. But about a third of people surveyed say some of the barriers that they see why they're not seeking mental health care is shame, embarrassment, or stigma. And so this just reinforces a third of the people out there are not reaching out their hand for help because of the shame, the embarrassment, the stigma. And those are negative labels that people are putting on our prospective patients who are on us. So now we get to the really bad stuff from the research. About 1 in 4 people don't even recognize that depression, anxiety, substance use, or eating disorders are forms of mental illness. So they're recognizing severe mental illness, but they're not recognizing kind of the rest of it as actual mental health conditions. And so we have room to go in making sure people understand this. And in substance use disorder, we have a lot further to go. 74% of Americans surveyed, and this is from Shadowproof does a regular Stigma survey on substance use disorder. So if you haven't seen Shadowproof, they're amazing in this space. But 74% of Americans do not see substance use disorder as a chronic medical condition. And it wasn't necessarily in this document that I pulled this from, but the majority of them are saying it's a moral failing versus a healthcare condition. And that's, again, one of the reasons why people aren't willing to raise their hand and ask for help, because so many, 3/4 of the country, or at least 3/4 of the people surveyed, are saying they don't see it as a chronic medical condition. The next one really, really kills me. So nearly half of the survey respondents in the Shadowproof Stigma survey say they're unwilling to live next door to someone with a substance use disorder. And that one for me is straight stigma. When I say I don't want to live next door to somebody like that, would I ever say I don't want to live next door to somebody with cancer or with diabetes? I would never say that, but when I'm saying I don't want to live next door to somebody with a substance use disorder, but also they don't understand the substance use disorder. So this one I take very personally, and I'll just say, so I actually am a person with a substance use disorder. Last week I celebrated 37 years of sobriety. I think I'm a really great neighbor. That's my stretching the applause, but thank you. I think I'm a great neighbor. I think my neighbors like me. If they would have known that I have a substance use disorder before I moved in, would they have looked at me differently? Maybe. This is saying half of the people don't want to live next to somebody. And that's, again, kind of a sad thing for our world. Now let's talk about the impact of stigma. So of course, at the beginning we talked about the definitions, but social rejection, you're feeling bad about it, you don't want to tell people what's going on. My example is, if your teenager needs braces, cool, you're gonna ask everybody about which orthodontist did you use. You're going to say, how did it work with the insurance? How did your kids react? No big deal, it's just braces. But if your kid needs mental health care or needs treatment for a substance use disorder, odds are you're not going to tell anyone. You're not going to ask anyone, and that makes that consumer so much more vulnerable because they're in that isolation and they're not going to get the quality care that they would have if they're actually talking to their network. They're probably not even talking to the school counselor or their primary care doc because it's so stigma is just creating this shame. It's a barrier to care. We already saw 30 of people who need care aren't getting care because of embarrassment or shame. And then it's all about the self-worth and belonging is a problem. In fact, here's just some stats about the barriers to care, just to reinforce that. 26% of Americans, this is saying, have a mental health condition, but only half of them receive care. And there's lots of reasons. There's workforce shortage, there's insurance problems, but one of those factors we know is about 1/3 of those people are saying it's embarrassment and shame. And about 16%, 17% of Americans, this says, have a substance use disorder, but only 6% of them receive treatment. I've seen it as high as 10%, but only 10% of that population is receiving care. So there's definitely a lot of barriers to care, and all of us at this event are people who can work on changing that. So that really makes me happy. Now let's talk about the different types of stigma that are out there. That internal shame, all those internal shame and embarrassment, those feelings, negative beliefs towards yourself. I should be stronger. I should be able to handle this. Even though there's care available, but I think I should handle this myself. Provider stigma, this one kills me. There's so much research out there that shows providers have their own biases. There's a lot of data, in fact, that shows providers spend less time with people who are obese or people who have obesity than other patients, and those are patients with a chronic healthcare condition. They probably should spend more time with them. When you think about substance use disorder or mental health, a lot of providers still have their real biases. I had a friend who once she had hand surgery, and the provider just started throwing opioids at her. And she asked him, she said, why don't you talk to me about the risks of opioids or ask about my history? And he said to her, well, addicts lie, why would I do that? They're not going to give me the truth anyway. And I hear that and I just cringe, but that's reality. There's still those providers out there. The community, of course, the community, there's all kinds of parents say, oh, you don't need to go get counseling, you need to be stronger, that's a weakness. And then the last one is societal. I'll tell you, the media doesn't do us a lot of help. There's little kind of pockets of goodness where the media is starting to show better representation for people with mental health conditions or substance use disorders, but still the majority of it is not great. So here, let's go through some of the good, the bad, the ugly of things, ways that people portray mental health and substance use disorder. And here's my first one. This is really some of the awful negative stereotypes that Hollywood perpetuates. I mean, the one's called The Joker, and then we have the movies called Psycho. And then Edward Norton has played a number of different people with mental health conditions. One of them is Fight Club, but he's been in other ones as well. All of them are just kind of caricatures with people with mental health conditions. Here's some really old ads that they had for, first one was Prozac. So with Prozac, you're not psychotic. When you're psychotic, you never ride alone. Take your Prozac today. Well, okay, you're using words like psychotic, and Prozac's been around for a long time. And the other two are kind of implying you can be fixed if you take your medications. And so again, we know these are chronic health conditions. You're not going to be fixed if you take them. This one's a little hard to see, but this is an ad in the UK for a mental patient costume for Halloween. And they actually had a lawsuit about this one, and they had to take it down because it was so negatively portraying people who were patients. So that's a positive, that somebody actually did a lawsuit and got this taken down because he's in a straitjacket like a zombie who's been killing people, and that's what is portrayed as a mental patient. And these are a couple around substance use disorder, just perpetuating negative stereotypes, saying that if you use meth, you're a thief, or this is what you look like. And yes, I don't want to sugarcoat that. There's a lot of people who have struggles, but do we need to perpetuate this in society? We don't really need to do that. This is one I think is kind of on the edge. This was Burger King a while ago, did one for Mental Health Awareness Month. They changed their Happy Meal to the Real Meal, and then they did all these different sort of feelings on the boxes, but they pretty much got slammed for doing this. And I'll say I'm kind of on the edge about this because they were trying to do something interesting. They were trying to say no one is happy all the time, which I think is okay. But people really criticized them for saying they were making light of it. Which, okay, so do the try to do something for mental health awareness, but don't make light of these conditions. And as you'll hear, one of my suggestions later on is why not bring people with lived experience into the process, see what they think, see if they think you're kind of mocking them. Now we have a couple of really good ones. Mental illness can affect anyone. This is a message that I would love to get out broadly because it's so important. Here's another great one. What I love is the imagery is you don't have the Joker or a Psycho. What you have is happy, healthy people shown here on an advertisement for mental health. And here they're saying there's research, treatments, hope, mental health, education, outcomes, better mental health. They're not saying they're going to fix anyone, it's just better mental health. I think this one is just really respectful. I love it. This one is a little hard to read, but I also really think this is positive. This is from Cornell University. She's saying up there, I'm fine, are you really? Encouraging people to ask the questions. And then here's her quote. She said, I wish I known everyone struggles. And then they're saying that they've got services and support available to help Cornell students impact a wide range of issues. And so I think do that one again. We're just saying that it's real and saying there's help available. And this is another one from Canada. It's a whole TV ad that I'm not going to play you, but the gist of it is mental health is health. And again, if you go back to some of the research, it's kind of divided whether they believe mental health is health. So we've seen some bad examples, so what not to do as marketers and communicators or practitioners. Don't depict these negative stereotypes. There's so many of these negative stereotypes. Obviously, in kind of your work, you're not doing something like Psycho or The Joker, something that rash. You're not showing a guy, a zombie in a straitjacket. But still, there's a lot of these. A lot of marketers will say, and especially in other industries who might not be as sensitive as ours, they'll say, okay, if I show something really dramatic, that'll get a better reaction. And do you really want to do that? Or then you're just showing all of the other people out there that this is the negativity. We see so much about that, especially around people who go to therapy. We see that mocked all the time in different TV shows, in movies, even in advertising. Again, we need to make it a good thing so people want to go and get therapy. And there's some progress, like there's a new show called Shrinking with Harrison Ford that has some goodness in it, but then also has some not so goodness about getting therapy too. So I feel like we're making progress, but we're not quite there yet, and really being respectful and showing care on how we show those stereotypes. Trivializing conditions, there's lots of media will trivialize things like OCD, depression, different phobias. These are all very real mental health conditions. And finally, saying that we can fix or cure people versus saying this is a chronic health condition that you're going to need care or you might need medication for the rest of your life because it's a chronic condition. Nobody ever says diabetics should stop taking their medication. No one ever says a person with hypertension should not take their high blood pressure medicine, but how often do you hear someone saying you shouldn't take your mental health medication? Now let's talk about what are the things that we can do. And for me, the number one thing is always to protect our vulnerable populations. As I said at the beginning, I mean, there's so many families that are suffering in silence and they're afraid to ask for help. So what they're doing is they're Googling at home, they're finding all of your practices, they're getting the information you're putting out there, and they're so vulnerable. So we have to be really cautious that they're getting good, factual information. Even if you think about substance use disorder, Steve earlier mentioned about the legit script certification, and some of you may or may not be familiar with that, but a few years ago, I think in 2018, 2019, substance use disorder was banned from advertising on Google. And then a while later, they came up with legit script certification to make sure only ethical providers were able to advertise on Google. And this was because Google was seeing all these very vulnerable people being taken advantage of by unethical providers in this space. And so this is where we have to just take caution. I've heard this as a theme throughout this whole conference. Every session I've gone to, people understand that our audience is different than someone just scheduling an annual physical or going to the dentist or like the orthodontist, they're going to the orthodontist. Our population is very vulnerable, and because of stigma and shame and isolation, they aren't getting the advice from others that they might have gotten. What else can we do? We can educate providers in the community so we don't end up with situations where you have an actual real life provider saying, oh, addicts lie, so I never ask them questions. Or when they're not really recommending that somebody take their mental health medication because it's going to help them for a chronic healthcare condition. Another thing we can do is normalize mental health conditions, making sure people understand, like that Canadian ad, mental health care is health care. And for me, it's continuing to say it's a chronic healthcare condition like diabetes, like hypertension, and nobody ever blinks an eye when you say diabetes or hypertension. But do they really believe that substance use disorder or mental health conditions, depending on the condition, is like that? Those are things that we can do. We can help change that narrative. using person-centered language. And this one for me is really simple, but it's subtle, and it's something that anyone who's a marketer or even a practitioner can do. We never say someone is cancer. We say someone has cancer. We started to shift the conversation around obesity. In the past, we kind of said he is obese. Now we're starting to say he has obesity because he can have medication to treat his obesity. So we're starting to get there, but with mental health and substance use disorder, we're not always there. So there's still some language, and these are just some suggestions. You all probably have some other ideas, but one you hear a lot is like addict or junkie, and just really judgmental. The preferred term would be person with addiction or person with a substance use disorder. It's calling someone a schizophrenic versus a person with schizophrenia. At the beginning, Steve talked about he had a friend whose girlfriend had bipolar disorder, and versus saying she is bipolar. Again, it's very subtle, but it's separating you from your condition. Granted, I showed the movie Psycho. There's psycho, crazy, manic, insane. There's all these terms that, again, I don't want to be called that, so I'm not going to tell anyone I'm struggling, or I'm going to feel uncomfortable going to seek help because people are going to call me those names. Even in a joking manner, it's still, people internalize that and they don't want to move forward. Substance abuse is a biggie, and this one, like we still have SAMHSA still says substance abuse, and so substance abuse is still a toughie, but it's so judgmental. And substance use disorder, when we use that as a term, it reminds people that it is a mental health condition, it is a disorder, and it has been recognized as a disorder and a disease. So that one I think is really important. I will say that this is one I've had to fight with my clinicians over, because I will, if I use this or if I don't use this, because for Google search, Middle America, when they're searching for care, they're going to type in substance abuse. So that's when it's a toughie to say how to actually use that term, like on your website or in your marketing materials, because that's what Middle America calls it. So for me, it's kind of formerly known as substance abuse. Substance use disorder is kind of the way I try to spin it. But that's when I've had a lot of fights with clinicians over. Calling someone anorexic or abulimic, again, somebody with disordered eating, somebody with an eating disorder, because separating them from their condition. And the last one gets a little controversial, but when you say someone is clean, as far as being in recovery or sober, that implies that they were dirty before. So again, that one's a little controversial. I will note with all of these that the most important thing is to kind of use the sort of golden rule and ask people how they'd like to be described, because people will have different terms that they prefer for themselves. So I met a woman who with autism, and she says she prefers to say I am autistic because it's more part of her identity versus a condition. That's the way she looks at it. So I took that to heart. And I had a gentleman on my marketing team once who was on the autism spectrum, and he would prefer to say that he has autism. So it's just kind of also, we need to make sure we're checking in with people with a lived experience and seeing how they would prefer. What else can we do? Focusing on authentic representation and inclusive marketing. I'll just start with inclusive marketing. I think it's always so important for all of us to make sure that our marketing looks inclusive. So people of all shapes and sizes are in our marketing, because we want to make sure people feel seen in our marketing, and that they say, oh, wow, someone who looks like me is getting care, I can get care there too. And then authentic representation, I just am so thrilled with some of the people who are really public about their mental health conditions. You've got Simone Biles, you've got Michael Phelps, two of the best athletes we've ever seen, and they're out there talking on a regular basis about their mental health conditions and the fact that they both gotten care. They both, over the last few years, have been spokespeople for different providers. And that's just so important, because people can look at them and say, my gosh, if a world-class athlete like Simone Biles or Michael Phelps is getting care for their mental health condition, maybe I can do that too. And I know it's tough to sometimes get real people to be your spokespeople, But when we've got people like that more normalizing it and being real authentic people, it just helps so much. Encouraging equality, I've mentioned this several times, making sure we liken mental health to a chronic condition, like diabetes, like hypertension, because those are ones that everyone seems to understand are chronic conditions and that we'll be using medication or getting care for the rest of our lives. Countering misperceptions with facts. This is one I think that all of us, anyone near the healthcare marketing field is dealing with these days. Making sure you're using your experts. For me, bringing experts like psychiatrists, psychologists, clinicians, physicians into my marketing, using those as reference points is really important to counter any myths that are out there. And then also reinforcing that these are all acknowledged diseases. And I threw up some of the dates. I might not have them all right, but these are what I could find. So in the DSM-3, so many years ago in 1980, they officially recognized depression and anxiety as disorders. They had variations of them in the past previous to that. But going back to 1956, that's when the AMA first recognized alcohol use disorder as a disease. And you saw in the research that I showed before that 74% of Americans still don't see it that way. In 87 was when they finally classified addiction as the broader category as a disease, and in the 2013, the DSM-5 is when they recognized substance use disorders as the category. So substance use disorder as a term goes back all the way to 2013. We're still battling that with substance abuse too. So these are another way just to reinforce all those misperceptions with the facts. And lastly, I'm just going to say lead with empathy. And empathy is a term I think I've heard in every single session here, because I think we all understand we need to lead with empathy. This is a very vulnerable audience. There is care available, but when we're leading with empathy, it's so important. A couple of the AI talks and a panel I was on yesterday, we talked a lot about balancing AI with empathy and making sure we're really using authentic ways to communicate with people. But empathy is really ultimately putting ourselves in their shoes. And that's, for me, so important. And, okay, I'm gonna play one more commercial, and this is one of my favorite commercials out there in the mental health arena. Partially because it's so pointed, but also because it's reminding us that everybody could use a little help. This shows up on your TV. It's saying all of us could use 30 seconds of silence. All of us could use a little help. And I know people who work at Calm, and I've used their apps in the past, and they're doing a lot of work. But for me, this is saying we don't need to do targeted marketing. The whole world could use a break. And finally, I just want to say I'd love to stay connected. I'd love to hear from all of you and what you're doing around stigma. This is just an area I'm super passionate about. How do we break down stigma? So please, connect with me on LinkedIn. I put my email address there. My website, I added my book. We didn't really talk about my book. My book's not about stigma. But I just love to continue the conversation. I do this talk a lot, generally in healthcare, but for me, my passion really is around mental health and substance use disorder. And I'm really excited. A lot of times I worry like one person will show up at a stigma talk because there's other cooler, like, go to a different session, learn about AI or something. But this is one impacts all of us, and everyone in this room is, we're the people that make a difference with substance use disorder and mental health stigma. We'll wrap up with a quote that NAMI uses a lot. NAMI, the National Association of Mental Illness. And for me, this is kind of like how do you combat stigma. So thanks everybody. Anyone have any questions or comments, suggestions? Okay. Okay, great. Well, we'd love to chat with all of you.
Thank you. Okay, wonderful. More good stuff coming up at the top of the hour, 11 a.m. Here we have writing and content creation panel. It's a panel. And then also we have still two more